everyone, and welcome to the Scalp Cooling Summit. During this session, we are going to discuss scalp cooling with anthracyclines and breaking away from taxanes only. I think, as a lot of us know out there, there's a lot of myths about scalp cooling only working for taxanes. So we thought we'd take this opportunity to review anthracycline specific data and dispel some of those myths out there. One of the questions I have received from providers is, most of the clinical trials that were done in breast cancer at least looked at anthracyclines followed by taxanes. And is there data to switch the order since we know the efficacy of scalp cooling is higher with taxanes first? And I would argue that actually the efficacy in terms of benefit to patients is higher when you sequence a taxane followed by an anthracycline. There's a lot of studies that have come out that show about a 3% improvement in pathologic complete response rates when you give taxanes first, followed by anthracyclines. And part of the reasons is that you're able to maintain dose intensity, because when you give anthracyclines first, they're more likely to struggle with neutropenia and other problems resulting in dose reductions. And I see Christian nodding his head. Christian, has that been your experience as well?
The consequence of these data or these topics is that in most actual studies for neoadjuvant chemotherapy of breast cancer, the taxane-based phase of chemotherapy is preponed. So it's I don't know any large study starting with the anthracycline neoadjuvantly. In clinical routine, it may be different, even in Germany. So it's not so that every center in Germany is starting with the taxane, but that would my preferential way of delivering chemotherapy in the neoadjuvant setting. Due to several reasons. The first is, of course, it's not scalp cooling, but it's the efficacy of chemotherapy, which may be higher. It could be the possibility to avoid anthracyclines completely, at least during the neoadjuvant part of chemotherapy. But the second is of course the higher hair preservation rate with when starting with the taxane. And I don't know the reason exactly. It should be investigated from a scientific point of view. My explanation is that the taxanes are very strong cell dividing poisons, and maybe they lower the turnover rate of the hair roots. And the scalp cooling is preventing the hair loss, of course, during that phase. And when the anthracycline starts, the cell dividing rate in the hair roots is already lowered, and that maybe and the hair roots may become more resistant to anthracyclines. So that's my personal explanation, but I don't have any idea whether it will hold true or not. So it's a matter of debate, of course.
So it's been a great discussion so far. So I kind of want to move on to kind of talk about what is a success, because that's come up. So with paclitaxel, 100% hair retention, that's like amazing, right? But the reality is it's not going to be that high with anthracyclines. So maybe we can go around and maybe share some of our experiences with patients and what you would consider a kind of successful number and what kind of your hope and dream number is in the next 5 years that we can achieve. So, Jen, maybe I could start with you.
Yes, I think it's important for the patient to how they expect the result. So 100% retention is not achievable. So if we lower the expectation, they can be usually satisfied with the results. They are satisfied with just with a cap, the hair loss is not prominent. With that kind of result, the most patients are satisfied if we explain the the result, they usually satisfied. That's my experience from scalp cooling.
And Mary, you were kind of talking about defining success for patients. If you can elaborate on that a little bit.
I think for our, success for us, we started in the beginning as 50%, and we've done our own internal quality of life study with our patients. And in some cases, I think success is determined by the patient. So understanding what their expectations, as Jen mentioned, managing the expectations and asking the patient what their expectations are, sort of sets the stage for understanding where the opportunities are to help the patients understand what we can accomplish. But I think we initially set a 50% goal. And more often than not, I believe in one of our discussions, about 75 to 80% of the patients were more than satisfied with the 50% hair retention. So I agree 100%. If we just start with the patient's perception, we can move a lot further and promote the scalp cooling for them.
For taxanes.